I'm going to be talking quickly about tarsal coalitions. Tarsal coalitions is an area, a subject that podiatry should own, and in fact does. It's a condition that occurs with some degree of frequency, and to the untrained person is frequently, if not more often than not, misdiagnosed. The clinical presentation is generally a pain, deep aching in the area of the coalition, and not uncommon, the onset occurs or the symptoms occur after some strenuous activity or trauma. Again, they seem to be somewhat age-specific, TN coalitions in very young children, although we don't see too many of these. CN bars will generally first manifest or become symptomatic in the 8 to 12-year-old range, and TCs a little bit older in the teenage years. With your suspicion of it, the next thing is to come to a firm diagnosis. Imaging will make the diagnosis in most cases for you. We're fortunate nowadays. We have all kinds of advanced imaging, MRs and CTs. Bone scans are probably not terribly useful here. Back in the day when these things were first identified, remember, it was done without benefit of a CT scan or without benefit of an MRI. And in fact, tarsal coalitions were first identified in the early or the mid 1800s before Roentgen even developed his X-ray tube. And basically what those outcome studies do is support what I just told you. In the absence of DJD, in the absence of greater than 50% articular involvement, resection should be the first line. In cases where you have significant arthritis, fusion of the hindfoot, either the subtalar joint or complete triple arthrodesis is indicated.